Hello, everyone. My name is Dennis DeYoung, and I'm a business relations specialist here at Opportunities for Ohioans with Disabilities. I'd like to welcome you all to the Employer's ADA Handbook, Reasonable Accommodations and Undue Hardship. Today's training is the second in a series of 5 webinars. I'm excited to be co-hosting with my colleague, Julie Wood. Julie, would you like to introduce yourself and tell us a little bit about today's presentation?
Sure. Thank you, Dennis. Hello, everyone. We are happy to have you join us today. My name is Julie Wood, and I am the Worksite Accessibility Specialist here at Opportunities for Ohioans with Disabilities, which we refer to as OOD. I am also an occupational therapist and recently became an ADA coordinator. My primary role at OOD is to provide consultations and deliver educational presentations to support the employers we partner with in creating workplaces that are diverse, inclusive, and equitable for employees with disabilities. One important way employers do this is through understanding the best practices for navigating Title I of the Americans with Disabilities Act, which we refer to as the ADA. In January, we kicked off the Employer's ADA Handbook webinar series with an overview of the responsibilities covered employers have under Title I of the ADA, and we shared best practices. Today's webinar is focused on reasonable accommodations and undue hardship, and our goal is to deliver a general overview of these responsibilities that employers have with providing reasonable accommodations, because this is one of the main purposes of Title I. And so we will discuss a variety of topics, including what reasonable accommodations are and when they need to be provided, and also what to expect in a request for an accommodation, and then what steps to take to identify an effective solution. Certainly, we will touch on undue hardship and confidentiality as well. Now, in this 1-hour webinar, we won't be able to share everything there is to know about reasonable accommodations, but in addressing some of the main highlights and also providing resources, we certainly hope this will be a useful tool for employers.
Thanks, Julie. So before we get started, I'd like to share our available resources. Today's training comes with the PowerPoint slides, a learner's guide, which includes the resources Julie mentioned, and a helpful fact sheet. So to access these now, a link is posted in the Q&A section of Microsoft Teams. Just as a reminder, the information we share in these resources and during today's conversation is for educational purposes only and is not legal advice. But we do hope this information is helpful for you. We will be stopping about halfway through today's presentation and once more right before we conclude to answer questions. So please post your questions in the Q&A box at any time, so they're ready for us when we stop. Julie, you mentioned one of the main purposes of Title I is the requirement for employees to provide reasonable accommodations to applicants and employees with disabilities unless doing so causes an undue hardship. How about we start with defining reasonable accommodation?
Dennis, a reasonable accommodation is a change in a work-related function or process that removes a barrier and enables an individual with a disability to access equal employment opportunities and to participate in work-related activities.
So, Julie, what kind of work activities might an individual need an accommodation for?
Dennis, there are 3 categories of work-related activities where reasonable accommodations must be provided when they're needed. And these include to access the hiring process, to perform the job's essential functions, and to enjoy the privileges of employment. What providing a reasonable accommodation does is enable an applicant or employee with a disability to compete for a job, access the work environment and perform the job, and also enjoy the benefits of employment as equitably as employees without disabilities.
So, reasonable accommodations are comprehensive and touch all aspects of employment. What does the term reasonable mean, according to the ADA?
Dennis, to answer that, I am going to reference the EEOC guidance and use its language directly. So first of all, the EEOC is the Equal Employment Opportunity Commission, and this is the entity that regulates and enforces Title I of the ADA. The EEOC says an accommodation is reasonable when it seems reasonable on its face, for example, ordinarily or in the run of cases. And the guidance further states that reasonable is an accommodation that seems feasible or plausible. And so to illustrate what this means, I have an example from a webinar I attended about reasonable accommodations. And in this example, the employee's job is to deliver packages for a delivery company, and the employee requests a reasonable accommodation to work remotely from home. So this request is not reasonable on its face because it's not feasible to perform the essential function of delivering packages from a home office. Reasonable also means the accommodation does not cause an undue hardship, and so we will talk about that later and discuss how to assess undue hardship.
That will be helpful because we know this is determined on a case-by-case basis. So I understand a reasonable accommodation is a work-related change that enables an individual with a disability to participate in work-related activities, like accessing the hiring process or performing the job. But what is a reasonable accommodation?
Well, Dennis, there are many examples of reasonable accommodations in the workplace, and we will highlight some of these later. But the EEOC helps us to understand the many ways reasonable accommodations can be provided by organizing these into main types, which include making the work environment accessible, restructuring a job, permitting a flexible schedule, altering or providing equipment and services, modifying policies, and providing reassignment.
So there are quite a few ways reasonable accommodations can be provided. Could you also tell us what changes are not considered reasonable accommodations?
Sure, Dennis. Not all modifications and items are considered a form of reasonable accommodation and therefore are not required to be provided. For example, employers are not required to eliminate the essential functions of a job as a form of reasonable accommodation. And just as a reminder, essential functions are those fundamental and critical tasks of the job. Also, an employer is not required to lower quality or production standards as a form of reasonable accommodation because employees with disabilities are expected to be able to perform the job's essential functions with or without a reasonable accommodation. And personal use items that are also needed off the job are generally not considered reasonable accommodations, and these include items like wheelchairs, hearing aids, and eyeglasses. Covered employers are also not required to provide accommodations that cause a direct threat to health or safety or that cause an undue hardship, which is an accommodation that is too costly or too difficult to implement.
So Julie, how does an employer know to provide a reasonable accommodation?
Providing a reasonable accommodation generally begins with a request from an applicant or an employee with a disability. Because this request can be made at any point in the hiring process or during employment, it can be helpful to recognize what constitutes a request. That way it's not unintentionally overlooked. So here's what the EEOC guidance states about a request for a reasonable accommodation. It must indicate a request for a change at work that is related to a disability or a medical condition. It may be communicated in the individual's preferred form of communication, for example, an email or a verbal conversation or a written note. And the request may use plain language, which means the individual does not have to reference the ADA or use the term reasonable accommodation. I do have some examples to share from the EEOC guidance of what is and what is not a request for a reasonable accommodation. So in this first example, an employee tells her supervisor, "I'm having trouble getting to work at my scheduled starting time because of medical treatments I'm undergoing." This is a request for a reasonable accommodation. In the next example, an employee tells his supervisor, "I need 6 weeks off to get treatment for a back problem." This is also a request for a reasonable accommodation. In the third example, a new employee who uses a wheelchair informs the employer that her wheelchair cannot fit under the desk in her office. This is a request for a reasonable accommodation. In the final example, an employee tells his supervisor that he would like a new chair because his present chair is uncomfortable. Although this is a request for a change at work, the statement is insufficient to put the employer on notice that he is requesting reasonable accommodation because he does not link the need for the new chair with a disability or a medical condition.
Those examples do help to illustrate how to recognize a request for a reasonable accommodation. Julie, in a previous webinar, we discussed the importance of training supervisors on how to recognize a request for a reasonable accommodation.
We did, Dennis, and this is because the results of a research study conducted by Cornell University showed employees with disabilities are at least 60% more likely to disclose a disability to their supervisor than someone in human resources.
So what is best to include in the training?
It's helpful to first address how to recognize a request for an accommodation so it's not overlooked, and then inform supervisors of what steps to take when a request is received. Then include information about the confidentiality rules that apply to the disclosure of disability and providing reasonable accommodations. And because we know supervisors receive questions from coworkers about the reasonable accommodations they see in the workplace, include training on how to respond to these questions without disclosing confidential information.
Training is very important, and I know we are going to discuss this again in the presentation when we discuss confidentiality and communications. Now, when an employer receives a request, the EEOC guidance says to act quickly and to begin the interactive process to identify the need for the accommodation and an effective solution. So the request is the first step in the interactive process. What happens next?
Dennis, after an employer receives a request for an accommodation, the next step is to verify the disability exists. When the disability and the need for the accommodation are obvious, this verification is simple and quick. When the disability or the need for the accommodation is not obvious, such as when an employee has an invisible disability, such as depressive disorder, an employer is permitted to request reasonable documentation. Now, an employer does not have to obtain documentation and alternatively could ask the employee about the limitation related to the disability that is being impacted at work and how a reasonable accommodation can help.
So, Julie, what do you mean by reasonable documentation?
Reasonable documentation means you are just asking for the information you need to verify the employee has a disability under Title I of the ADA and that a reasonable accommodation is needed. The kind of information you might need would be about the disability-related impairment, which is impacted at work, and how a reasonable accommodation would enable the employee to participate in the work activity. It isn't reasonable, and so it's not permitted to request medical information that isn't related to work. And it would be extremely rare to ever need an employee's entire medical file. So asking for that would not generally be reasonable.
It sounds like the employer should obtain only what they need and nothing more. So who provides this documentation?
Dennis, the employer is permitted to request the documentation come from an appropriate professional, and who that is will be unique to the type of disability the employee has. So it could be a medical doctor or a licensed mental health professional or an allied health professional such as an occupational therapist. I do have some examples from the EEOC guidance of when an employer may request documentation. And so in the first example, an employee with a learning disability attends frequent meetings, and one of his essential functions includes taking notes. Due to his disability, he has substantial difficulty writing. So the employee tells his supervisor about his disability and requests a laptop computer to use for taking notes during meetings. Because the disability and the need for the accommodation are not obvious, the employer may request reasonable documentation about the disability, which could include the nature, severity, and duration of the disability, the activity the disability limits, and the extent to which the disability limits the employee's ability to perform the activity. The employer may also ask why the disability requires the use of a laptop computer to help the employee record the information from the meetings. In the second example, an employee gives her employer a letter from her doctor stating she has asthma and needs an air filter. The letter contains insufficient information as to whether the asthma is an ADA disability because it doesn't address the severity of the asthma. For example, whether it substantially limits a major life activity. Also, the letter doesn't identify what problem exists in the workplace that requires an air filter or any other reasonable accommodation. So the employer can request additional documentation. I also have two examples from the EEOC about when an employer may not request documentation. So in the first example, an employee requested a reasonable accommodation 1 year ago. So the documentation that was provided at that time came from the employee's psychiatrist and indicated the employee has bipolar disorder, that the condition is permanent, and would always involve periods of exacerbation and remission. The documentation also explained during a flare-up, the employee's symptoms could cause serious problems with the ability to care for himself and to work, and that medication helps to control the frequency and severity of these episodes. So now, a year later, the employee requests a reasonable accommodation related to the same condition. Based on these facts, the employer may not request documentation to verify the employee has a disability under the ADA because the disability was verified in the previous year's documentation, which stated the disability was a permanent condition. However, the employer may request reasonable documentation to verify the need for the reasonable accommodation if the need is not obvious. And in the second example, an employee provides documentation from her physician stating she has diabetes and needs to test her insulin levels several times a day to avoid a hyperglycemic reaction. The documentation explains that a hyperglycemic reaction can include extreme thirst, heavy breathing, drowsiness, flushed skin, and eventually would result in unconsciousness. Depending on the results of the test, the employee might need to take insulin. So the documentation requests the employee be permitted 4 10-minute breaks each day to test her blood sugar and, if necessary, to take insulin. So the documentation provides sufficient information that the employee has an ADA disability, but because it describes a substantially limiting impairment and the reasonable accommodation that's needed as a result. So based on this information, the employer cannot ask for additional documentation.
So Julie, does the employee provide the documentation or does an employer use a certain form?
Dennis, either party can provide the documentation. Sometimes an employee will obtain the necessary information from the appropriate professional, like we just discussed in some of the examples. If an employee requests a reasonable accommodation without providing documentation, an employer can use a standard form to verify a disability or the need for the accommodation when it's appropriate to do so. The Job Accommodation Network, which is commonly known as JAN, does have an example on their website of a standard form for documentation. So employers could review this form and then customize one for their own needs. We went ahead and included the link to this resource in the learner's guide.
Okay, so after the request is made and the disability and the need for the accommodation is verified, the interactive process continues. This is a collaborative process between the employee and the employer.
Yes, they both work together to identify an effective solution. And the best place to start to do that is with asking the employee what ideas he or she has, because the employee is likely to know what will work best. However, the employee is not required to know the solution. What the employee is generally responsible for is explaining the barrier being encountered at work that is related to the disability and how it prevents participating in a work-related activity. And then the employer may ask the employee questions about the nature of the disability, the impairments impacted at work, and about the barrier the employee is experiencing. These questions are intended to help the employer identify an effective, reasonable accommodation. Certainly, when you're in the interactive process and trying to figure out an effective solution, it's helpful to be open to new ideas and processes. Sometimes we think there's only one way to do something because that's how it's always been done, but in reality, there's often more than one way to perform a task.
So Julie, often the employee and the employer are successful in identifying a solution, but when they aren't, what resources are available to help?
Dennis, there are resources which can be helpful in identifying reasonable accommodations. The first one, and with the employee's permission, an employer could ask the employee's medical provider for recommendations or to comment on an accommodation being considered. Also, during the interactive process, you can mention our services here at OOD, which are voluntary, confidential, and free. Our vocational rehabilitation services provide Ohioans with disabilities the services and support they need to find or keep a job. So if the employee is interested, he or she can apply for services through our website at www.oodworks.com or call us at 1-800-282-4536. And there's also 2 federal resources that both employers and employees can consult for reasonable accommodations and about disability employment matters. And these are the Job Accommodation Network and the ADA National Network. The ADA National Network has 10 regional centers, and Ohio is in the Great Lakes region.
Thank you, Julie. And we have included those resources in the Learner's Guide. Now, once ideas for effective reasonable accommodations have been determined, who chooses which one will be implemented?
Dennis, ultimately the employer may choose which reasonable accommodation will be implemented. For example, if 2 ideas are identified and one costs more than the other, the employer may select the less expensive solution as long as it is effective. However, it is a best practice to consider the employee's preference when choosing the accommodation.
So Julie, what happens when the employee and the employer are unsure whether a selected accommodation will be effective?
Right, there will be times you won't know if an accommodation will work until you try it. And so in that case, an employer could consider implementing a trial period. When you do, it's important to create a written agreement between the employee and the employer which states the reasonable accommodation is being trialed, also indicates how long the trial period will last, and describes what will happen if the accommodation does not work.
So do you have any ideas for what to do when the trial period includes buying equipment? Because if the accommodation doesn't work, the equipment has already been purchased, right?
Right, so there are some ideas an employer could consider. First, we do have lending libraries throughout Ohio which permit employers to borrow items for a period of time, often at no charge, which would enable the accommodation to be used in the work environment to determine if it will be effective. So we've included information in the Learner's Guide for those lending libraries we are familiar with. If you can't obtain the item for a trial in the work environment without buying it first, you could check to see if the item is available at a nearby store and try it there. For example, in my previous role as an occupational therapist, I have met with clients at an office store to try out an ergonomic chair to identify a proper fit before the chair is purchased. For those times when you must purchase the item to try it at work before you buy it, ask the vendor about their return policy and when the item needs to be returned to get a refund. And ask what the return shipping costs are and whether there are any restock fees, just in case the item doesn't work and needs to be returned.
Well, a trial sounds like a great tool to use when you need to test out an accommodation first to identify if it will be effective. What happens once an accommodation is implemented and effective?
Dennis, once an effective solution is implemented, it's a best practice to periodically monitor the accommodation for effectiveness. Accommodations can stop being effective when there is a change in the workplace or a change with the disability. Also, some accommodations need regular maintenance or software updates to remain effective. So creating a schedule to monitor an accommodation is important to ensure the employee has what is needed to perform the job.
Thanks, Julie. Those are helpful ideas for identifying and implementing reasonable accommodations. In previous trainings, we have shared that neither the ADA nor the EEOC require employers to create a formal process for navigating the interactive process, but doing so is a best practice. And in 2020, we delivered a webinar which discussed best practices for navigating the reasonable accommodation process, and this training is archived on our website if that is helpful for you. Okay, let's take our first break and see what questions have come in. And we have a number of them. Julie, our first question: if an individual requests a work schedule that better fits with the availability of public transportation, would this be a reasonable accommodation request?
It may be. You want to look at the request to see that it's requesting a change at work and is related to a disability or a medical condition. And so if in this request a individual references a disability, then I would consider that a request and begin your interactive process. If you're not sure, you could always just ask the employee a little bit more information about why the request is needed to see if they'll share a little bit more information if you're not sure if it's related to a disability. So it might be lacking all of the information that's needed, but I would ask a few more questions.
Right, that makes sense. Okay, our next question. Can additional documentation be requested if the requested accommodation changes or the need increases? For example, an employee is requesting breaks or leave beyond what was initially indicated by the medical provider.
To answer this, I would reference the example that we gave during the presentation of when you may ask for additional documentation. So in this situation, it sounds like you've already identified there's a disability, so you would not be asking for additional documentation to verify a disability. But if the need for a second or a different accommodation is not obvious, when it's not obvious, you are permitted to ask for additional documentation.
Thanks, Julie. All right, next question. Who determines the essential functions or role, for example, the HR manager, etc., and can that be communicated in different ways, such as writing, in writing, orally, etc., to the employee? Does that make sense?
It does, and that's a great question. So employers are able to determine what the essential functions are of their jobs, and this can be determined in a variety of ways. So it's usually a collaboration between a person who does the job or a person who supervises the job, and it can be in collaboration with human resources. You as the employer really can decide that. We did provide a training that's archived on our website called Inclusive Hiring, and it did talk about essential functions, and it did talk about how we write these, which is another part of this question, that you can use inclusive language to write the essential functions in a way that's really more focused on the outcome instead of the method, because as we mentioned, there's more than one way most of the time to perform a task, and so you want to focus on the outcome. And so my recommendation would be to either reach out to me and we can talk about this in more depth, because there's some resources I could share with you that identify best practices for how do we really assess what are the essential functions, and then how do we use that inclusive language to write these so that they're outcome based. So we could point you in the direction of that archived training, which is on the employers page of the OOD website. And I am able to consult with employers to talk about this a little bit more in depth offline, if that's helpful.
Okay. Next question. Does COVID-19 to work from home, can that be considered a reasonable accommodation?
It can certainly be considered a request for a reasonable accommodation. The pandemic does not change the employer's obligation or responsibility to provide reasonable accommodations to qualified employees with disabilities. And so whenever you receive a request for a reasonable accommodation, you begin the interactive process, just like you would any request, and you verify the disability exists, you verify why the reasonable accommodation is needed and how it will be helpful, and you explore ideas, and then you determine if it's reasonable. And so COVID-19 does not change anything about that process. Whether or not an accommodation is reasonable or is an undue hardship because of what an employer may be going through because of the pandemic, maybe that has changed, but you still go through the process and do the proper assessment to determine that.
Okay, and the last one is kind of related, so I'm going to go ahead and throw it to you.
Okay.
Is an employer responsible for providing reasonable accommodations for employees working from home, and it doesn't matter if the work at home situation is temporary, such as during COVID-19, as opposed to a permanent home-based position?
Right, so it does tie in with what we just talked about. So the pandemic and the state of COVID-19 does not change this obligation to still enter into the interactive process. We know that the interactive process is always a collaboration between the employer and the employee, and the identified effective solution is always determined on a case-by-case basis. So what a person needs at work versus a home remote work environment is going to be unique to that person and to the disability they have and the type of work that they do. In the beginning of the pandemic, it was identified as a best practice that some accommodations might be implemented on a trial period, because when we entered into the pandemic, we didn't know, we still don't know how long we're going to be going through this. And so employers put together maybe a trial period or a temporary period, but some kind of agreement between the employee and the employer identifying that this accommodation is being provided because of the current circumstances and will be addressed again at a later time if the work environment changes as employees are starting to come back to work. So certainly during your interactive process, you can consider implementing accommodations on a temporary period and then just indicate when they will be readdressed.
Perfect, that makes sense. Thanks everyone for your questions. So Julie, earlier you said the EEOC helps us to understand the many ways reasonable accommodations can be provided by organizing them into various types. Now is the fun part, where we get to share examples for those types of accommodations.
I agree, Dennis. This is the fun part, and examples do help us identify the many ways reasonable accommodations can be offered.
So let's start with making the work environment accessible. This accommodation includes making the physical built environment of the workplace accessible and addresses areas like parking lots, entrances, workstations, shared areas like break rooms, and also signage and emergency exits.
Dennis, this is certainly an area an employer may receive a request for a reasonable accommodation. Before I share an example, I do want to say under Title I of the ADA, employers are generally not required to make existing facilities accessible unless an applicant or employee with a disability requests an accommodation. However, employers are encouraged to make changes for general accessibility, and for employers who wish to do so, I have provided some resources in the Learner's Guide, which include the ADA checklist for existing facilities, which was created by the New England ADA Center, and it's based on the 2010 ADA standards for accessible design that come from the Department of Justice and are regulations that apply to Titles 2 and 3 of the ADA. The standards provide minimum requirements for new construction and alterations of existing buildings, So this is a good resource to consult for both an understanding of what those accessibility guidelines are, but also for any guidance on the responsibilities you may have under Titles 2 or 3. It's important also to be aware when you are providing a reasonable accommodation under Title I, what an employee needs with a disability needs for accessibility of the built environment may at times be greater than what the minimum requirements are in the standards.
That is important to know. So what are some examples of reasonable accommodations for the physical built environment?
Dennis, these kinds of examples include installing a ramp at a building's entrance so it's accessible for an employee who uses a wheelchair, or removing obstacles that might be a hazard between a workstation and the common areas to make navigating internal pathways accessible for employees who are blind, and adding flashing lights for those audible alarms which are used to alert employees to emergencies, so the alert is accessible for employees who are deaf and hard of hearing.
So Julie, how about restructuring a job? What examples do you have for this kind of accommodation?
Dennis, this reasonable accommodation includes either redistributing the marginal functions of a job or modifying how marginal or essential functions of the job are performed. As a reminder, the essential functions are those fundamental and critical duties of the job, and marginal functions are those duties which are not as critical. Now, employers do not have to eliminate or redistribute essential functions of the job as a form of reasonable accommodation, as we mentioned earlier, but they can if they want to. Now, when an employer chooses to redistribute the marginal functions of the job as a form of reasonable accommodation, the employer may swap the marginal functions from another job to the responsibilities of the employee with a disability if these are tasks the employee is able to perform. So I do have examples to share for restructuring a job. The first example involves a cleaning crew in an office building. One crew member wears a prosthetic leg, can walk well, but has a limitation with climbing steps. He can perform the job's essential functions, but cannot perform the marginal function of sweeping the steps. The marginal function of another crew member includes cleaning the small kitchen in the break room, which is something the first crew member can perform. So as a reasonable accommodation, the employer can switch the marginal functions of these two employees. The second example involves an employee with a disability that limits his ability to manually take notes using pen and paper. The reasonable accommodation provided included the employer restructuring how this essential function is performed by permitting the employee to enter the notes into a computer using speech recognition software. And the third example involves an employee with an intellectual disability who can perform the job's essential functions, but has difficulty remembering in what order the tasks must be completed. The reasonable accommodation provided included the employer restructuring how these essential functions are performed by providing the employee with a checklist of the tasks to perform and in what order.
Thanks, Julie. And up next is permitting a flexible schedule, which can include adjusting the hours an employee works, modifying a break schedule, altering when work tasks are performed, and permitting the use of leave. What examples do you have to share with us?
The first example is for modifying a break schedule. In this example, an employee with HIV infection must take medication on a strict schedule. The medication causes extreme nausea about 1 hour after it's taken and lasts about 45 minutes. The employer provided a reasonable accommodation in the form of modifying the employee's break schedule and permitted the employee to take a daily 45-minute break when the nausea occurs. And I have an example for adjusting work hours. In this example, an accountant with a mental disability requested to leave 1 hour early on Thursdays for 12 weeks to attend therapy sessions with a psychiatrist. The employer provided a reasonable accommodation in the form of adjusting work hours and permitted the employee to shorten his lunch break from 60 minutes to 30 minutes, 2 days a week, to make up for the hour he missed when leaving early on Thursdays during this 12-week period.
Okay, what about altering or providing equipment?
Dennis, this category includes providing items such as assistive technology and equipment, and there are many examples of these in the workplace, so I'll just share a few. In the first example, a claims representative with low vision is having difficulty reading paper files. So as a reasonable accommodation, the employer purchased a stand magnifier and added task lighting to the workstation. In the next, a medical technician who is deaf and performs timed laboratory tests was provided with a visual timer to alert him when time is up and a test is complete. In the next example, a food service employee has the use of only one hand and can perform all work tasks except opening cans. And so the employer provided the employee with a one-handed can opener. In the next example, a janitor with a congenital heart problem requested lighter equipment to perform his work, and his employer provided him with a lightweight mop, which enabled him to perform the essential function of mopping with minimal strain. And in the final example, an insurance sales representative with limited fine motor skills was not able to hold the phone and take written notes when talking with customers. So the employer provided a phone headset, which enabled the employee to use the phone hands-free and take notes effectively.
So another category of reasonable accommodations refers to services such as qualified readers and scribes, sign language interpreters, and professional live captioning.
Yes, and I have a couple examples to share. The first one is an applicant with a learning disability who is applying for a job as a firefighter. His disability limits his ability to comprehend what he reads under time constraints, like a testing environment. So he requests a reader for the application test. Because the test strictly measures knowledge, the employer provides the reasonable accommodation. In the second example, a code inspector who is deaf just began a new job at a municipality. He requests an accommodation for communicating during training and when working in the field. So the employer provided a sign language interpreter for training and provided him with a mobile device that has texting capabilities for working in the field, and both of these accommodations were effective for the employee.
And how can an employer modify a policy as a form of a reasonable accommodation?
Well, Dennis, this can include modifying the policies you have for things like attendance, leave, fragrance, no animals, no food or drink at the workstation, telework, training, and testing. So in the first example, an employer has a policy which prohibits eating or drinking at the workstation. An employee with diabetes explains to her employer that she may occasionally take too much insulin, and to avoid going into insulin shock, she must immediately eat a candy bar or drink fruit juice. The employee requests permission to keep these items at her workstation to use when needed. So in this case, the employer must modify its policy and allow this request unless it causes an undue hardship. In the second example, it's about modifying a no animal policy, so an employee who is blind and uses a service animal is permitted to have the animal in the workplace. And a final example is to modify a training policy, which could include providing training materials in alternative formats, such as large print, or permitting an on-site job coach.
Yes, and we provided a training in November of 2020 called Job Developers and Job Coaches in the Workplace, which talked about this type of reasonable accommodation in detail. If you'd like to access that training, it is archived on the employer's page of the OOD website. And our final category is reassignment, which is known as the reasonable accommodation of last resort. So what does that mean?
Dennis, this accommodation involves reassigning an employee with a disability to a vacant position, and it's considered when an employee with a disability is not able to perform the job's essential functions with or without a reasonable accommodation because of the disability. It's considered the reasonable accommodation of last resort because employers are encouraged to first determine if a reasonable accommodation exists that enables the employee to perform the current position. Reassignment does require the employee to be qualified for the vacant position, and the vacant position is expected to be equivalent in terms of pay, status, and benefits. So here is an example from the EEOC guidance for providing reassignment. A host at a restaurant can no longer perform the essential function of escorting diners to their seats due to a disability which requires him to remain mostly sedentary. However, he is qualified to perform the essential functions of a vacant cashier position, which has the same salary. So the employer offers reassignment to the cashier position as a reasonable accommodation. In the Learner's Guide, we've included the link to the EEOC guidance on reasonable accommodation, and reassignment is addressed in this guidance. So we hope this information may be helpful for employers to review when they encounter the need for this accommodation.
These examples help clarify the many types of reasonable accommodations available, so thank you. Now, when we mention the responsibility under Title I for providing reasonable accommodations, the sentence always concludes with, unless doing so causes an undue hardship. And we've alluded to what this means throughout the training, that an undue hardship is an accommodation which costs too much or is too difficult to implement. Now, determining undue hardship isn't to be based on an opinion or assumptions, but rather on an individualized assessment of the current situation.
That's correct, Dennis. Determining undue hardship must be based on a case-by-case basis because each employee, job, and employer are unique. The EEOC does provide criteria for employers to consider when assessing undue hardship, which includes factors like the cost and the nature of the accommodation in relation to the specifics about the facility, such as how many employees you have, what your financial resources are, what effect the accommodation may have on the facility and its expenses and resources, and what type of operation you have, and how the reasonable accommodation would impact operations. The criteria also includes consideration of whether you are part of a larger entity.
So Julie, do you have an example that may help to illustrate what an undue hardship looks like based on a facility's operations?
Yes, I have an example of this directly from the EEOC, which involves a clerk at a convenience store. The clerk has multiple sclerosis and requests to reduce from full-time to part-time work as a reasonable accommodation because of his disability. The store assigns 2 clerks per shift. If the first clerk's hours are reduced, the second clerk's workload will increase significantly beyond his ability to handle his responsibilities. The store determines this request will result in inadequate coverage to serve customers in a timely manner, to keep the shelves stocked, and to maintain store security. So in this example, the employer can show undue hardship based on the significant disruption to its operations, and because of that, refuse to reduce the employee's hours. In this case, the employer should explore whether any other reasonable accommodation will assist the clerk without causing undue hardship.
So when an accommodation results in an undue hardship, what happens next?
Dennis, the interactive process should continue between the employee and the employer to determine if another accommodation exists that is effective and reasonable. The process doesn't stop just because one effective solution causes an undue hardship. Also, when an employer is faced with an undue hardship related to cost, Congress intended for employers to consider their net cost after applying outside funding sources or tax benefits they are eligible to receive. So we've included some resources for outside funding in the Learner's Guide, which includes an Assistive Technology Resources Funding Guide from the Assistive Technology Industry Association. There's also an article on funding from the Job Accommodation Network. And the Internal Revenue Service has a resource called Tax Benefits for Businesses who have employees with disabilities. Also, as I mentioned earlier, our agency, Opportunities for Ohioans with Disabilities, offers services to support eligible Ohioans with disabilities in finding and keeping a job. And so at times we can help identify effective accommodations as well as share in some of the initial cost of implementing accommodations.
Julie, what happens when an employer is not able to find an effective, reasonable accommodation after a case-by-case analysis and consideration of outside funding sources?
Dennis, when this occurs, the employer should explain to the employee how the accommodations identified create an undue hardship. When the undue hardship is based on cost, the employer should give the employee the option to pay the portion that is an undue hardship. As a reminder, when an employee with a disability is not able to perform the essential functions of the job with or without a reasonable accommodation due to the disability, reassignment to a vacant position should be considered.
Julie, so how often does this case-by-case assessment result in an undue hardship for employers?
Dennis, I am not aware of studies or statistics which indicate how often an accommodation causes an undue hardship for an employer, but I can share some information about the cost of accommodations which may be helpful. According to the Northeast ADA Center's Small Business at Work Toolkit, one of the top 5 reported concerns of providing reasonable accommodations in the workplace is cost. However, this concern that reasonable accommodations are costly is more of a myth than a fact. First, many employees with disabilities do not need accommodations at work. Now, when an accommodation is needed, a survey from the Job Accommodation Network revealed 56% of accommodations were free. And of those that required a one-time cost, the typical cost was $500. So based on these studies, accommodations are often reasonable from a cost perspective.
Julie, there are also studies referenced in the Northeast ADA Center's Small Business at Work Toolkit, which revealed employees with disabilities perform as well or better than employees without disabilities and are absent less and stay on the job longer than employees without disabilities.
Correct. So these results demonstrate hiring and retaining a qualified and talented employee with a disability is a good business decision, which means providing reasonable accommodations when they're needed is also a good business decision.
Okay, so let's turn to our final 2 topics, confidentiality and communication. When employers receive a request for an accommodation, this can include personal and medical information, which is required to be kept confidential. The EEOC guidance indicates this information should be kept in separate medical files and stored apart from general personnel files. Are there exceptions to this rule of confidentiality?
Dennis, there are times when certain information may be shared. For example, employees who facilitate reasonable accommodations during emergency situations may be provided with the information they need to handle an evacuation or a shelter-in-place emergency. Also, supervisors are permitted to know about the proper implementation and use of a reasonable accommodation by an employee they supervise. However, in both of these cases, the safety professionals and supervisors are not permitted to know why the accommodation is needed, and so certain confidential information may not be shared. For example, a supervisor may know an employee is receiving a reasonable accommodation, which permits shortening his lunch by half an hour so he can leave early 1 day per week, but isn't permitted to know it is to attend an appointment with a mental health professional to treat an anxiety disorder.
Julie, once a reasonable accommodation is identified, implemented, and working effectively, we know coworkers sometimes have questions and ask their supervisors about why a colleague is receiving what they perceive as special treatment. Sometimes the disability is invisible, but the reasonable accommodation is not, which may lead to questions. Because the ADA prohibits an employer from disclosing an employee's disability and requires information about the disability and reasonable accommodation be kept confidential, how should a supervisor respond to these questions?
You are correct, Dennis. The supervisor is not permitted to tell the coworker the colleague has a disability or is receiving a reasonable accommodation. The term reasonable accommodation is unique to the ADA, and so using this term would automatically disclose the employee has a disability. Instead, what the employer may consider is training supervisors on the EEOC criteria for confidentiality and advising them of how to properly respond to these questions. The EEOC does offer ideas for crafting a response, which we've included in the learner's guide. And what you may consider is reviewing this guidance with your human resources team and your legal professionals to craft a response that's unique for your organization. You may also consider being proactive and provide ongoing training for all your employees on the laws you are required to follow, which would include Title I of the Americans with Disabilities Act and the right to reasonable accommodation for qualified employees with disabilities. This awareness may prevent coworkers from asking questions about a colleague's reasonable accommodation. Some topics that are beneficial to address in this training include information about the employer's reasonable accommodation process, contact information for making a request for an accommodation, and the confidentiality rules that apply to personal and medical information. Another best practice is to educate all your employees on disability awareness. We can assist employers with this through OOD's no-cost training, which is geared toward making everyone feel more comfortable and included at work. If you'd like information on our disability awareness training, please contact your local business relations specialist. We've included their contact information in the learner's guide with their coverage area by county, so you can easily identify which specialist serves your area.
Thanks, Julie. We also delivered a virtual training on disability etiquette last year, which is archived on the employer's page of our website for on-demand access. Okay, let's take one more break to see what questions we have. I'm going to start with the first one. Can you define the term obvious? Disabilities tend to live on a continuum of severity and impact differently. When it is appropriate to determine an impact is not obvious and additional documentation is needed.
Yeah, that's a good question. So we talk about how some disabilities are obvious, apparent, and others are not obvious or invisible. And so an example of an obvious disability might be when you receive a request from an employee who has a mobility impairment and they're asking for a ramp or they're asking for a door to be widened so the use of a wheelchair is able to access the environment. These are disabilities and accommodation needs that are obvious when they're not obvious and they're more invisible. So for example, we shared some examples of being able to leave early one day per week to attend a session with a psychiatrist related to depressive disorder or anxiety disorder. Those are not obvious to us, and so those might be situations where we can request for documentation to verify the disability exists. You've mentioned that disabilities are on a continuum, and you're correct. So two people might have the same diagnosis, and one does rise to the level of a disability under the ADA. And so when that's not obvious, you may request documentation. And I would just approach this as, you know, what is reasonable? Think is what is reasonable? Is it reasonable to me that this person has a disability or needs an accommodation? And if not, when you're permitted, ask for that documentation.
Thanks, Julie. And thanks everyone for your questions. That is all the time we have for questions at this time. If we did not get to your questions, and I know there's a number of them that we haven't gotten to, Julie has agreed to stick around for a few minutes after the presentation to answer anything we did not have time for. So if you need to leave, no worries. This will be archived with the rest of the presentation on the employer page of the OOD website. Okay, Julie, I know you have some final thoughts you'd like to share before we close.
Yes, thank you, Dennis, and thank you all for your questions, and we will stay on to get to the ones we haven't answered yet, so thank you. We know Title I of the Americans with Disabilities Act requires covered employers to provide reasonable accommodations, and so we hope by discussing this responsibility, highlighting best practices, and sharing examples, we have illustrated providing reasonable accommodations are often affordable and effective in enabling employees with disabilities to perform their jobs. And as we highlighted, hiring individuals with disabilities is a good business decision. We know employers have many responsibilities, and so we invite you to contact us when you have questions about Title I, or if you would like more information on the services we offer. Thank you for being here today, and Dennis, it's always great to co-present with you, so thank you.
Thank you, Julie, and thank you all for joining us. As a reminder, please remember to submit the training evaluation to give us feedback and to receive HRCI credit. We will be posting a recording of today's presentation and will forward that link to you at a later time. And I'd also like to announce our next virtual training is March 24th, 2021. It is the third in our series, The Employer's ADA Handbook, and it is titled Performance, Conduct, and Safety. So please be on the lookout for that announcement. We'd love to have you join us again. Thank you all, and if you're not sticking around for questions, we'll see you next month. Okay, Julie, it looks like we have about 6 questions that we didn't get time for, so I'll just start with the first one. I have a client that wants to use medical marijuana and also wants to obtain employment. Is there any accommodation for this?
That's a good question. So this sounds like this is not the employer that's asking about this. I would like to look into what Title I says to medical marijuana, because it does address controlled substances and when people are going through rehabilitation. And so this medical marijuana is fairly new in the past couple of years. So I would like to take a closer look at that and how it applies to Title I to be able to give you a good, clear answer. So if you would like to either email me directly or leave your information here so I can do some follow-up and get some resources for you, I'd be happy to do that.
Thanks, Julie. Next question. Can you discuss reasonable accommodations when an applicant applies for a position?
Sure. So applicants with disabilities are protected under Title I of the ADA if they're qualified. And so certainly an applicant with a disability can request an accommodation for the hiring process. Now, what that accommodation will be unique to the individual's impairment and whatever aspect of the hiring process is presenting the barrier. So we provided a webinar on inclusive hiring. It's archived on our employers page of the OOD website. It has a lot of great ideas for the different barriers that can exist throughout the process. So, an accommodation could be providing the job posting in an accessible format, so maybe in large print or an electronic format. It could be providing an interpreter for an interview. And so those are just a couple of quick examples. I'd be happy to talk with you offline if you have a specific aspect of the hiring process you want to talk about, or again, I'd recommend the training that we have archived on the website.
Perfect, thank you. All right, next question. If it is determined that a reasonable accommodation cannot be provided due to undue hardship, and there is no vacant position that the employee is qualified to perform, what is the resolution?
And so we always hope we don't get to this place.
Right.
If you've gone through the interactive process and identified there is no reasonable accommodation that will be effective to enable the employee to remain in their current position, and there are no vacant positions available, you might consider if there is going to be a vacant position in the near future. And if there's not, then if there is not a reasonable accommodation available, if the person is not qualified to perform the job, then the person may not be qualified to do the job. I would talk with your legal team and your HR team to determine the next step at this point.
Perfect. All right, Julie, last question. How many accommodations become too many before it is unreasonable? You change hours, modify tasks, and implement assistive tech and extra breaks for anxiety.
That's a good question. And that is going to be determined on a case-by-case basis. So an individual with a disability is permitted to request more than one reasonable accommodation, and employers enter into the interactive process and evaluate these requests for accommodations one at a time. And so during that assessment, if at any point an accommodation is determined unreasonable or an undue hardship based on that criteria from the EEOC, then it would be determined an undue hardship at that point. But it really is a case-by-case determination.
Thanks, Julie. And thank you, everybody, for those great questions. That was the last question, so we are going to conclude at this point, and we look forward to seeing you all again next month.